I hope you're having a great day and I hope you're staying safe at home. Well, today I want to talk about muscle tightness. A lot of people who have sedentary lifestyles or who train a lot, runners, people who run marathons, we get this muscle tightness. Sometimes it's a sciatica problem, it's a hamstring problem, it's a quad problem, it's a knee problem. Today, a lot of people who have knee problems, immediately jump into just treating the knee. That may be right, but without looking at how flexible your hamstrings are, how flexible your quadriceps are, and your calf muscles. Picture this, you have your knee in the center, okay, it's connected to your calf muscles and it's connected to your hamstrings and your quads. If your hamstrings and your quads are tight and your calf muscle is tight, it pulls on your knee, leading to knee pain. A lot of people jump into knee replacements immediately without addressing the root cause. I'm not saying you may need your knee replacement, but have you addressed the root cause of your pain? Today, when you get into the healthcare system, people have a fix for you, a quick fix immediately. So you put a lot of money, you get the quick fix, you're good for a month or two, and then you have the same pains again. That's because you didn't address the root cause of the problem. So if you have a tight hamstring and a quad, okay, or you have a tight sciatica, or you have a tight calf muscle, you are going to have a knee problem. The same way, if you have a lower back problem and you're only treating the lower back without looking at your glutes and you're not looking at your hamstring, because if the hamstring and the glutes are tight, they tug on your lower back, okay, causing that dull throbbing pain that you have on your lower back. So some people go on endlessly popping painkillers, they go for physiotherapy. I'm not against this. My point is, have you addressed the root cause? Today I'm going to talk about an investment that you should make if you've not yet made it. It doesn't cost you a lot of money, but it's definitely worth it. A foam roller. A lot of you must be already using a foam roller. You can Google this, you can YouTube it. It's a simple, small, you get large foam rollers, you get small foam rollers, you get travel foam rollers that you can even carry with you when you travel. When you're sitting on a long flight in a seat for several hours, your calves get tight, your hamstrings get tight, your lower back starts to hurt. You have a small foam roller, you can foam roll even while you're traveling, and that will help you reduce the pain. Now, how does a foam roller work? Number one, and why does it give us so much of relief? How many of us enjoy massages? Why do we feel so good when we're getting a massage, especially a deep tissue massage? It's a little bit painful, but as the knots within our muscles start getting looser and looser, we feel a sense of relief and we feel a sense of pleasure because our muscles are constantly tight. They have knots within them. They interchange. They sometimes cross one another, and then the nerves get pinched and we have pain. So with a massage which is well done the right way, it makes us feel good and relaxed because those hard muscles tend to loosen up. Now, we can't always get massages done when we want to, and especially with lockdown, we can't do that. But what you can do is order a foam roller and start using it. Now, what we need to understand is that every muscle is basically covered with something called a myofascia, a myofascial tissue. So picture this is a muscle. You have a myofascial connective tissue that goes around this. So if that tissue tightens up, you have pain in the joint area or the muscle. Muscles and joints work together. For a muscle to contract, there is a joint involved. So when you look at your bicep, it's connected with your elbow, that's a joint. So if there's a problem with your elbow, you will feel it in your muscle and vice versa. So with a foam roller, we have the ability to slowly roll out these myofascial tissues. And as these connective tissues resume their original form, the pain tends to get better and better. So when you look at this, we have tightness today because we're sitting all the time. So we have issues with our quads, hamstrings, calves, knees, lower back, and sciatica. So when you have a sciatica problem, okay, you don't just treat the IT band or the sciatica. What you need to do is treat the corresponding muscles. And this is something that you can do on your own. You can do it on your own from the comforts of your own home. Of course, there's a right way of doing it and there is the wrong way of doing it, and we're going to speak about that. If you have a sedentary lifestyle, you don't use your muscles, you lose them. It's as simple as that. What you do not use, you lose. Whether it's a muscle, whether it's your brain, whatever you don't use, you will eventually lose. And that's why the body is designed for movement. Movement is medicine. We got to keep moving our bodies the right way. A lot of people who overtrain also tend to have tighter tissues and tighter muscles. If you train and you don't recover well, which means you don't sleep well at night, or you're training the same muscle over and over again. I don't understand why people train 7 days in a week. People with the best bodies don't even do that. You need recovery because your muscles have to recover, your joints, your cartilage, your tissues have to recover. But people prefer to punish their bodies with exercise to make up for a bad diet. Remember, you can never outtrain a bad diet. Your muscles need recovery. Even yoga. You don't have to do yoga every day. No one said you need to do yoga every day. You need to practice maybe 2 or 3 asanas that suit your body type. That you can do every day. But a 1-hour yoga class is not necessary because the body needs recovery, period. When you're doing yoga, that's not recovery. People lift weights and say, yoga is my recovery workout. It's not your recovery workout. It's a workout by itself. Maybe not with the same intensity, but you're still using your tissues, your joints, your muscles, and all of these things. So don't overdo it. That's extremely important. So when it comes to your foam rolling, it can release the hardness from your muscles. It can improve your joint range of motion. Range of motion is extremely important. Like I said, if you cannot touch your toes the right way without bending your knees, you know you have a problem with your range of motion. And if you don't improve that, that's going to become a problem as you age. Even the way we move our shoulders, our arms, using our rotator cuffs, people ignore these little things, and then we decrease our range of motion. We get into high intensity workout programs, CrossFit and all of that stuff. These are great workouts, but you need to be fit to do these workouts. If you do it without being fit, without having flexibility in your joints, you get injured. And that's what's happening with most people today. They jump into intensive workouts without first fixing the basics. Do I have flexibility in my joints, my muscles? Do I recover well enough? And that's how you prevent injury. So over and above that, for the health of your muscles, your tissues, your joints, you also have to look at the right diet. If you're deficient in D3, if you have an inflammatory diet, if you have too much of white sugar and processed foods, this delays your healing process. Your sleep and your recovery is extremely important, and your exercise. Select a workout program that suits your body. And as you get stronger and stronger and you find that workouts becoming easier and easier, then you graduate to the next level of intensity. You don't just wake up one day and throw yourself into CrossFit or into heavy deadlifts and think that you're doing something great for you. No. People have to train several muscles before they can do a proper deadlift. And that's why you find a lot of people in gyms get injured, because they start ego lifting or they start to try to lift weights when their basic muscles are not yet strong enough to facilitate that particular movement. So coming back to foam rolling, it's a beautiful exercise for you. You can YouTube different ways to foam roll, right from your neck to your calf muscle, your back. All of these muscles can be loosened up with foam rolling. It's a beautiful exercise that you can do. You can look at YouTube videos. You can ask your trainer to teach you simple foam rolling. Now, why does it hurt? When you start off with foam rolling, certain areas, like when you do your sciatica or your glutes or your calf muscles, you find that it pains. Don't worry about that pain, but don't push it either. That pain is nothing but your hardened muscles. So when the foam roller starts rolling out your hardened muscles, you also compress your pain receptors, and that sends to your brain a signal of pain. The more you do it, the less the pain is. That means your myofascia is opening up, your connective tissues are opening up, and your muscles are actually now in the right way they're supposed to be. So you can foam roll the area above your knee, below your knee, towards the back, your calves, your glutes, your lower back, your upper back, and even on your neck. Do it the right way. Now, some of the mistakes that people make, don't overdo it. Nothing in life should be overdone. Do not overdo it. If your body's cold, you've just woken up, warm up a little bit, walk around, do a couple of skips, jumping jacks, and then do it. Because if you foam roll a cold body that is tight, you can cause more injury. Secondary, let's say you're foam rolling your quads, and if there's a lot of pain, do not keep pushing through the pain. A lot of trainers will keep rolling, keep rolling. No, be gentle with it. Tomorrow it'll be a little bit better because you progress, and the next day and the next day. Don't just foam roll through that painful point thinking it's going to get better. Everything heals in a state of rest and recovery. So do not do that. That's a big mistake. And remember, if you have a problem in your sciatica, just foam rolling your sciatica isn't going to sort it out. Your sciatica is connected to other tissues and muscles in your body. So maybe, like I said, to correct a knee problem, you will foam roll your calves, your quads, and your hamstrings, and your knee automatically gets better. So you don't really have to foam roll the exact point of pain or where your problem is. So if you have a lower back problem, it doesn't mean you go and start foam rolling your lower back. Start off with your hamstrings, your glutes, your lower body, your upper back, your cervical, and slowly as the lower body pain starts getting better and easing up, then you can gently start foam rolling your back. Do not overdo it. I don't know why people think More means more results. Less is more, but done the right way with the right form. Even when you foam roll, make sure your form is right. Your core is tight, you're not bending, your posture is not wrong, because in the process of foam rolling, you may put more pressure and stress because of your bad posture on some other muscles and some other joints. So remember, you can do it with a sore muscle as well, very, very, very gently. You can foam roll before a workout, after a warm-up, or you can do it after a workout, or even on your rest days, you can foam roll. And as it gets easier and easier, you know, automatically you feel lightness in your body, your flexibility improves, you recover quickly from the workouts that you're going to do. So your foam roller could be this small, it could be this long, it could be fancy, it could be, you know, inexpensive. Go online, check out a foam roller and order it. Use it while you're in lockdown, because a lot of people are sedentary right now. A lot of people don't have access to physiotherapists. They don't have access to their massage therapists. So you can use this as a gentle way of massaging. Do it the right way. And as always, if you have an issue, you have an unexplained swelling, all of that stuff, don't do things without keeping your professionals or your doctor in the loop. But add foam rolling. You see, as we age, a lot of people have tightness in their bodies. You know, they can't get out of chairs without, you know, without the help of something. They can't squat. They can't get into a malasana position. As we age, we're not supposed to become less and less capable of doing things. If we look after ourselves right now, as we age, we need flexibility. And if we have less stiffness in our body, we can age gracefully. We can age beautifully with flexibility, and that prevents more pain and improves our quality of life as we age. Have a great day, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.